In today's Focus on Your Health, Moffitt's adolescent and young adult program addresses the unique concerns and emotional needs of young adults with cancer. And here to explain why this is such an important program are Dr. Damon Reed and cancer survivor Chad McLeod. Guys, thank you so much for coming on today. How are you?
Doing well. Great.
Okay, you know, the more we're getting to talk and the more I was reading before this segment, one, I hadn't even really thought about young adults getting diagnosis. It's kind of the group that falls in between the cracks, if you will. Is that correct?
Yeah, you're right on, Natalie. That is exactly the problem, is that we're trained to take care of either kids or older adults with cancer. Cancer centers are built to take care of older people or kids with cancer, but 7% of cancers happen in this age group of 15 to 40. This gap is being filled in by adolescent and young adult programs.
I'll say, what did you notice that wasn't happening, that they weren't receiving? What kind of support, or what was it that it was like a light bulb that was like, we need to create this program?
So I'm a pediatric oncologist, so taking care of kids, you mostly take care of the kid and the parents, for sure. I had the fortunate opportunity here in this area, because Moffitt's so innovative, to be able to take care of then 20-some-year-olds and then 30-some-year-olds. And I did realize that there's a different culture in adult centers than pediatric centers. And in particular, the most obvious and glaring thing is that this is a period of time where people are getting married and having children and finishing school and getting jobs. And so there isn't a lot built around preserving fertility. There isn't a lot about preserving schooling and early job and career growth. And so there were clear needs that myself and other people around the country recognized and want to try to meet.
And that is such a vital time now that you point out all of the life changes that do happen. I think that's a perfect time to bring in Chad. Chad, tell us a little bit about your story and how you've been able to see this program kind of evolve along with you.
Yeah, sure, Natalie. So I was first diagnosed 12 years ago when I was 23, and I had just graduated college, and most of my friends were starting their first jobs, getting married. So it was a tough time to be a young 20-year-old, and you're at a cancer center that mainly treats older adults, at least at the time. But I was treated, chemotherapy, radiation, surgery, went into remission, made it to the 5-year mark, where a lot of cancer survivors rightly celebrate. Sort of at that point, it was kind of an afterthought. I moved on with my life and was involved in my job and got married and had kids. And then 2 years ago, at 33, I had a very unexpected late recurrence at 33. And while I didn't necessarily want to go back to Moffitt and be treated again, when I got there, it was encouraging to see the changes that had been made in terms of focusing on young adults and programs and support groups, and it was definitely a different feel than it was when I was 23.
And I do want to point out some of those changes that you talked about in your life also involved an Ironman and the Boston Marathon. So obviously we were talking about how well you are doing as of right now, but what were those changes when you did have to go back to Moffitt? What were some of those changes that you did see?
Yeah, I think just the support groups, getting a monthly email from a program that says adolescent young adult program, here's what we have going on, here are the speakers, connecting you with resources, things that you might need, whether it's fertility programs or additional support contacts, people to be able to talk to in your age group. There was an element of that 12 years ago, but a lot of it was informal. You would see a young patient in the hall or in the hospital, and you would start talking, and you had an instant bond because you're both young adults, or some of them were teenagers, and we could share some of the things we were going through, and there was that support, but it was more informal. And I think now it's just, it's formalized, it's more throughout the institution than it was 12 years ago.
And I got to ask, where do you hope to see this program continue to go in the future? Because you've seen the need now, you've seen the success stories that have come out of it. What do you hope down the road?
There are some easier things to do, like create opportunities for patients to meet each other. We've been fortunate to work with Swim Across America and built the Moffitt Adolescent Young Adult Lounge, a wonderful space for patients to organically meet, and really the nicest looking part of the hospital. There are long-term goals, though. We want to improve cure rates, and we're doing research with the various wonderful disease-specific disciplines with colorectal cancer and breast cancer, leukemias, lymphomas, sarcomas, all these cancers that happen in the young adult population. And we also, beyond cures, we want to improve the cancer experience. It is never convenient to get cancer, but it is particularly inconvenient right out of college as a young person without seniority at your job, as a new parent. There's a lot of things that we could do to help people along and deal with the psychological impacts of a terrible diagnosis.
Well, again, I think this program sounds very important, and if you want more information on the AYA program, as it's called, well, you can give Moffitt Cancer Center a call or visit their website or even their Facebook page. All the information is on your screen. Gentlemen, thank you so much for coming in today. We appreciate it.
Thanks for having us.